What are the typical symptoms that people come to me when they've got a problem with a worn-out hip? And what generally happens is people have symptoms which progress over a period of time. So they might start off with fairly minor symptoms, maybe just finding that it's a bit hard to put their shoes and socks on. And then gradually, as things slowly progress, they might find that they can't walk quite as far as they would like. And if things get more serious, then they tend to find they can't sleep. And people's symptoms vary hugely. So sometimes people will get more stiffness and sometimes people will experience more pain. There's no one symptom that people will get, but the common thing that people see is a reduction in their quality of life. And they often start to try and cover it up a little bit, if you like, by saying, okay, I won't drive to the shop, I won't walk to the shops, I'll drive there and get park as close as they can. And what they start to do is live within their symptoms a bit. So they learn how not to twist so it doesn't make it painful. And people will carry on like that for quite a long time. But at some point, people will generally wake up and say to themselves, I've had enough of this. I need to do something about it. I want a better quality of life. I want to get back to doing sport, or I want to be able to play with my grandchildren. And these are the sorts of things that they lose when their hip symptoms get worse. And that's why hip replacement is such a fantastic operation at giving people back their quality of life. Hip replacement, cataract surgery, cardiac surgery are the three things that have the best quality of life improvement in medicine. And it's a really dramatic thing that we see when somebody comes in and they can't walk, they're limping, they're in pain all the time, they start to get ratty with their friends and their family, and then they're relieved of their pain. And so frequently people will say, I didn't realise how bad it had got. They're finding the painkillers don't work. They're getting constipated because of the tablets they're taking. They're not sleeping. And it has an effect on them and their families, and everyone's affected by it. And then when their pain is relieved and they're walking better and they regain their independence and their fitness, it rebuilds their lives, and it's a fantastic thing to watch.